ER is constantly on the go. I never know what's going to happen each day. There's always a queue of people coming in the door, and so we don't have time to sit back and spend hours waiting to see how things go. We need to work out very quickly whether we're dealing with something that's going to get a lot worse in the next couple of hours, or whether we've got time to try something and see how you go. Pathology is absolutely critical to what we do. Most of the patients that we have to deal with have got complex problems, or they're extremely unwell, or we need answers to questions, and we need them fast.
70% of diagnoses are because of pathology. The COVID pandemic really brought pathology to the forefront. It's always been important, but it's now really visible and a lot more crucial to public health. Eastern Health service 3 main hospitals: Box Hill, Maroondah and Angliss. And there's also some other smaller hospitals such as Yarra Valley, Yarra Ranges and Healesville.
We are very fortunate at Box Hill to have pathology on site. It means that there are no delays sending samples out to other organisations. We put the specimen into a canister and the canister into the chute, and seconds later the specimen's received in the lab.
Once the sample arrives in the laboratory, the specimen reception staff will then scan the request slip into our laboratory information system, and the laboratory information system will then send the necessary information to our specific analyzers.
The result comes off, it's reviewed by a scientist and a pathologist, and then with the press of a button it goes into the hospital's laboratory information system and the electronic medical record, and it can be viewed down in the emergency department or in the wards, wherever the patient is.
We pride ourselves in turning out results as fast as humanly possible, and that's also why we've got all this technology in place within the laboratory to help us get the results out in a really fast manner. Access to this information can actually help us save somebody's life.
Timely access to information is crucial for the health system to run efficiently and effectively. Here at Eastern Health, our clinicians now access My Health Record via our Cerner EMR system. Accessing information in My Health Record saves time. It may prevent tests from being duplicated. It may also prevent information being faxed, sent, discussed over the phone. For a clinician to be able to click on My Health Record and get access to information quickly, it's a time saver, it's accurate and it's efficient.
So we really just don't have much time. We need to get an answer as soon as possible, sometimes immediately. Having some information at our fingertips that's already there makes a massive difference to us.
Being able to just access it, to have it there without having to ring 3 or 4 different specialists plus the GP to pull that history together, it makes my job so much easier.
I have seen many instances where My Health Records has helped in terms of the patient and their management in hospital. Having access to My Health Records and past medical history helps me make better, superior clinical decisions.
Our recent data indicates that approximately 10,000 documents are viewed by Eastern Health staff each week in My Health Record.
Emergency services is an area where having that immediate access is so critical. So for us, having that universal access to a patient's My Health Record makes what I think is the biggest difference, because 10 seconds spent trying to chase up someone's record through a phone call is 10 seconds that I could be spending actually resuscitating you. Having access to quality information 24/7 is saving lives.